runner's knee is the most common injury we see. And it's much more common actually in females than males. And there are a variety of reasons for that. But usually it's kind of the hip angle that in females that might contribute to the problem. And the problem is actually recurrent. It's such a common issue if you don't correct some of the issues that are already present. And you may hear of runner's knee. There's different names for it. We got patellofemoral syndrome is a very common name for it. And a lesser common name is chondromalacia patellae. This is a nice little schematic of, the common running injuries that we see. And other common ones like IT band syndrome, Achilles tendinopathy, and even tibial stress fracture are there. But just to point out that runner's knee is by far the most common injury that we see. So before we understand runner's knee, love to share with you a normal knee and kind of how it functions. So here is a kind of like a pretty diagram of the quadricep and the kneecap. We see in our quads, we have 4 muscles there. We got the vastus medialis on the inside, the vastus lateralis on the outside, rectus femoris is the muscle on top, and the intermedius is way below. These 4 muscles attach to the femur, the thigh bone, and connect to the shin bone, the tibia, via the patella, tendon, and patella. And it's called a free-floating bone or a sesamoid bone embedded within the quad tendon. So you see all that force, all that muscle is all siphoned into one little area. So taking away the muscle, we have the kneecap. So here's a picture of the femur and the kneecap that's embedded on the femur. And it looks like a simple little bone hanging there. And what I want you to note is that the whiteness is cartilage. Behind the patella and on the femur, that white stuff is the cartilage that helps lubricate and reduce compression forces and helps with friction. So it's very well lubricated. What I really want you to understand here is that there's a lack of blood flow to that area. Cartilage gets nutrition through diffusion, movement, doing squats, walking, even running. But if it gets injured, just because there's not a great blood flow to the area, it takes a little bit longer for the healing process to take place. So you just have to kind of know expectations depending on the tissue of how fast it could possibly heal. This is kind of a rudimentary example, but it helps visualize the structure. Patella is kind of like the train on a train track. So if you can see the femur, there's like a groove where the patella sits. So it's this nice little groove that patella goes up and down in that groove. So as you bend your knee, this patella goes in this groove, and with increased knee bending, it's increased force on the kneecap, on the femur. And there's an old school of thought, I'm not sure if you guys have heard about this or not, but the VMO used to be a commonly implicated muscle in patellofemoral issues. The VMO is that vastus medialis muscle that I described earlier, the big muscle on the inside. They said, hey, that's weak, and so this patella is not keeping track on the train track here. Over time, that actually VMO was more old school way of thinking. So there was slight credence to it, but not that great. Though I don't want to miss the point that having strong quads really helps support the patella within that group. So why the heck do we have a patella to begin with? The patella helps the quad muscles work well. So it's kind of like an analogy of a crane, the picture here. They have that big post on top to help with leverage or efficiency of the crane to work. So the patella helps the quadricep muscles work a lot more efficiently and easily. If the patella was gone, the quadricep muscles would work much harder to generate force when running and stuff like that. So it increases the quad leverage. As you can see from the side, the patella is just resting right on the femur there. So it goes up and down as you bend your knee or as you load your knee when you're running. So that's normal knee anatomy or basic mechanics of the kneecap on the femur. Now, runner's knee, what is that? Usually symptoms are pain around the kneecap. It could be above it, below it, to the side. It doesn't really matter. Mostly I see it on the side. The onset can be gradual or very sudden. Usually if you have a very intense workout or increasing mileage really quick, it usually happens pretty quick. Or over time, if some issues aren't quite right. The symptoms people usually describe are, hey, it hurts going downhill, hurts when I squat, it hurts when I go up and down stairs. And the pain rarely radiates. So sometimes pain goes down the leg. That could be a nerve issue. And some people are like, hey, is it my meniscus? Usually the meniscus, there's an injury or there's more swelling with the meniscus and there's very point tenderness to help differentiate the two. Back to what I said earlier, you need blood to help with healing. So on the y-axis is a blood supply, and on the x-axis is the healing time. So if you have more blood supply like muscle, the healing time is much quicker. If you like bone is a little bit less blood supply, so it takes a little bit of time. And on the very end, the articular cartilage, what the patella is working with, takes a lot longer to heal if it is any injury or issues there, because it has a lot less blood supply. Pain science is a very interesting field, and it's growing exponentially right now of understanding what pain is. So I won't do it justice, but I want to make a point for you guys, especially when you begin running or increasing your running, that pain doesn't necessarily mean there's tissue injury. So in this little schematic I made, as you increase load, you'll feel the pain first. And if you continue or it gets a little bit overloaded, it would eventually potentially injure. But just because you have high pain does not mean there's any tissue damage. In fact, most of the time, clinically, I don't see a lot of tissue damage per se. It just could be irritated or just overly, inflamed for a little. An example I like to use is fire. If you touch your hand near a fire, it hurts, but you take your hand back and there's no damage. Of course, if you keep your hand in the fire, you will get damage. So just appreciate that with pain. With any injury that you have, first step is take a breath. It's probably not as bad as I think it is. But runners come in with a lot of hypotheses as why did I injure myself? Did I not warm up well? Did I not train right? Footwear, and the list goes on. And it could really be very difficult to decipher why it happened to begin with. And that's reality. It's a lot of stuff that could contribute to the injury or the pain that you have. So I'm going to pick on just two factors that I see clinically with runner's knee. The two factors I'm going to pick on are load and biomechanics. And I don't want to de-emphasize the power of sleep, of a training schedule, of eating well, stuff like that. And there's much more that I can add to this diagram. I label him personally my loading professor. So he kind of helped me understand the power of loading the tissue structures when you run or any kind of program in general. He focuses on increasing the loading capacity of runners, and I'll explain that in a moment. So what I see clinically is a lot of runners have very similar body type, especially endurance athletes. So like I said, most runners don't load well, and as a result, the tissues aren't as resilient to withstand the forces. So his argument is, hey, we need to strengthen, not just run, but strengthen the structures, not the muscles, but also the kneecap, the cartilage. And by the way, the cartilage is still tissue. So just because, like a muscle, if you train it, it can actually adapt and get stronger with time. If you unload it, it gets weaker. The whole goal here of loading well is to increase the resilience to run and reduce the risk of pain or injury to the tissue. So pulling from his slides, on the left hand, the y-axis is the injury risk. So the higher you go, the higher the risk, and training loads for the x-axis. On the left-hand side is a low training load, think couch potato, and on the very right is like more Olympic athletes. So what they found was the risk of injury increases when you have low loads or too high a load. The goal for loading is, hey, we want to create an adaptation, but not overload the tissue. We're just running through injuries. So in that blue little part of the graph, the adaptive homeostasis is when you kind of stress the tissue a little bit more, and so it adapts. And with time, you should see this loading, the uninjured area should get bigger and bigger. And another way to look at it is also by Dye 2005. On the left-hand side, its load is on the y-axis and frequency. So to kind of in a nutshell is the white area is a manageable level that we can work with. So say, hey, I'm going to run 1 hour. Perfect, no issues. If I run 2 or 3 hours, I get more in the excessive zone, and that's when my tissues begin to poop out and I might get pain or injured. When you do get injured, God forbid, on the second graph, that manageability goes way low because the resilience of the lower of the tissue is not quite there. So maybe I can only run for 30 minutes, but if I run my normal 1 hour, the tissue will begin to speak to me and say, not good. Hopefully, with load and the appropriate rehab, your manageable level keeps increasing. So it's hopefully this white area gets ginormous and the excessive area is much smaller. So your tissues can withstand the forces placed upon it. So in his research, in a nutshell, it's we have to load. And in the website, we have ways to do that if you're curious about it. But it's with squats and split squats and gradual loading progression in a very intelligent way to increase the resilience of the tissue. So that's point number 1. load the tissue to increase the capacity and the resilience to take on the loads they place upon it. Point number 2, biomechanics. So biomechanics is another issue we see with any runner, but especially maybe novice runners too. Here, example of person on the left, put in normal knee alignment, where it's just kind of over the toe and the knee's not caved in too much. And on the right side, you see the knee caving in. And for this, I have to give a shout out to a professor of mine, forgive the blurry image, is Dr. Chris Powers. He really did a lot of research on hip strengthening correlating to running or runner's knee or patellofemoral issues. So his main thing is butt strength. Along with the loading, butt strength is very crucial to help prevent runner's knee. I pulled this from one of Chris Powers' research in 2011, just a snapshot. The general theme here is this. Adduction, or you see on the very bottom, is pretty much a knee caving in. And on the left side, or the y-axis, is the average pressure on the kneecap. We'll just say patellofemoral pressure. So as you increase the knee caving in, there's an increase in pressure in the knee or on the knee to a point where we can argue it gets overloaded if it's not addressed. So going back to that, the person on the right is more pressure on that kneecap when your knee adducts or internally rotates or valgus, a lot of different names kind of for it. Secondary, potentially, to weak hips. There could be contributing factors, but for the sake of this argument, weaker hips and the knees not being stable in the plane. Basically, there's a strong correlation with hip strengthening and preventing knee pain as opposed to just strengthening the knee itself. So here's one of many JOSPT articles about the studies done behind that. And as I say that, and there's very powerful evidence behind it, but it doesn't explain everything. So there are runners that have knee pain that look like a mess. And I want to pick on one runner, and I'm going to horrible at names, and I apologize in advance. Prishka Jepto. She is a silver medalist marathoner. Her form looks horrible, but she's a very good runner. And so there's a lot of reasons why. She probably ran like that from a kid, and her tissues have adapted from the load placed upon it. But so I just want to get the point here is it's just not 1-to-1 ratio. People could look kind of messy, and that's how they just get their energy forward. So it's not necessarily like you have to correct every little thing, or not everything is a big issue. Point that I do want to make with number 2 is you cannot neglect the glutes or the butt or the hip, however you want to call it, to help with preventing running injuries or from the knee from caving in when landing.